Well, hi everyone. I want to officially welcome you to the Medicaid Adult Dental Benefits Learning Collaborative and to our May meeting. Want to go over a couple of housekeeping items with you, and then we will get into our agenda. So first thing is, if you're in a place where you're able to turn on your camera, would love to see your faces. But while presentations are happening, we just ask you to stay on mute, and you can raise your hand or come off mute at any point or use the chat to ask questions. I also want to alert you that the session is being recorded today and will be shared out in the follow-up materials. And we also want to encourage you to add your pronouns to your Zoom name, and you can do that by hovering over your video, clicking the three dots, and then clicking rename. So with that, I will share my screen to do a quick overview of our agenda, and then turn it over to our wonderful facilitator for today, which is Casey Wilson from Community Catalyst. Desired outcomes for today's meeting. We are going to hear the latest on the debt ceiling discussion in Congress. We'll do a mini check-in on the public health emergency unwinding. Casey also has an update for us about public charge that she'll share. And then we have three great state fellow advocates who will be sharing some updates from their state on what's happening in Medicaid, and also hoping to ask for some help and assistance in some of the challenges that they're facing. And I'll end by sharing some open announcements and next steps. For our check-in question today, looks like I didn't write one down, so I'll be on the spot. Well, spring is here. Maybe we'll do this. Who has, if you have a green thumb, if you're gardening, you can put that in the chat. Or if you're like me, I can't keep any plants alive, you can share that in the chat as well. And maybe you have some tips for us on how to do that. So maybe that will be today's check-in question. Okay, so I'll stop sharing and turn it over to Casey.
Thank you, Bianca. Hi, everyone. Thanks for joining. I think I have to turn it right over actually to Melissa Burrows from Families USA, who is going to give us an update on debt ceiling negotiations.
Yeah, thanks, Casey. So we've talked about this a few times over the past couple months when we've met. So this may be not new news to any of you. It's also dominating a lot of political headlines, but we do want to make sure that we think through the specific implications that this discussion has for oral health and for our work. So as you all likely know, Congress and the president are in the midst of trying to reach a deal around increasing the nation's debt ceiling so that we don't default on our debt. The Republican majority in the House has been using this opportunity to try to move a number of policies that, cut programs in various ways to generate, money. And it would be really problematic for the nation to default on its debt. That would have a lot of implications for folks that rely on, a lot of different programs, and for folks that are, economically unstable in our country. However, the deal that's being put forward by the Republicans has some really concerning pieces to its proposal on all of the various programs that low-income families rely on. But in Medicaid in particular, there are proposals to implement broad-based work requirements for folks that rely on Medicaid and on other programs, and that essentially would amount to cuts to the Medicaid program. It would essentially kick people off their coverage, and also would have implications for how states end up getting funding for Medicaid coverage in ways that really are problematic, in that A, people would lose their coverage unnecessarily, and B, as states are potentially seeing squeezes to their state budgets because of funding changes, that could have implications for optional services like oral health being cut. So that's why we're talking about this. The latest is that Congress and the president are going, or the congressional leaders and the president are going to be trying to reach a deal over the next week. June 1st is the current deadline for as to when they need to have a deal finalized. There are a number of paths this could take. It could be a true negotiation where they come up with something they can all agree on. It could be that they kind of pull a stopgap measure that would allow the House can kind of activate a stopgap measure that allows the president to kind of move the debt ceiling forward without coming to a deal. And that could happen if a handful of Republicans choose to vote for this emergency measure. It's possible. The minority speaker of the House activated the beginning part of that process early this morning. Or we could default on the debt, or they could pass a clean debt bill that doesn't, negotiate anything. So those are all the paths that could happen. We really don't know how this is going to resolve. But what we've been doing as an advocacy community for quite a while now is ensuring that everybody knows it would make us all really angry, and it would hurt a lot of people to put work requirements and or other cuts onto the Medicaid program. So that's the latest. Casey, feel free to add anything else that I may have missed, but we wanted to keep you all posted. Happy to answer any questions. And, it'll be important for us to keep laying out all the long-term implications of this, because these proposals, even if they don't happen now, will certainly come back around through election season and in any future Republican majorities. So that's where that is.
Thanks so much, Melissa. I just have one sort of quick plug that Community Catalyst is working with Protect Our Care to support some state meetings with key senators on the debt ceiling negotiations. So there's a day of action planned next Tuesday, so very, very tight window, but I'm going to put the target states in the chat. So if you are in one of these states, there is some support available through Protect Our Care for kind of logistics, scheduling, back-end stuff, and there will also be talking points and other advocacy resources available. So trying to do some of the heavy lift on the back end, knowing that it is a tight deadline. So if you're in one of those states and you have a relationship or a connection with the associated Senate office, and you have capacity or interest in setting up a meeting, feel free to reach out to me. I can get you looped in with the folks who can help support. I'll put my email in the chat and just leave a second if anybody has questions about that, or for Melissa about the update.
Sorry, my audio cut out for a second, so I think you just turned it over to me, but can you say again, just in case?
I was just leaving a second if people had questions for you, Melissa.
Okay.
But I didn't hear anything. So if people do have questions, feel free to reach out. I will volunteer Melissa for that, but obviously you can reach out to me too if you'd like. And then just one other quick flag before we move to some updates, that there's a somewhat pressing issue around public charge. The Senate is set to vote later this afternoon, so we're getting like tighter timelines as I continue talking. Also very targeted, so there are a couple of states, I'll put them in the chat in a second, but so folks probably remember that during the Trump administration, there were changes made to the public charge rule that were pretty damaging in terms of people being able to access health services, including dental services, particularly in Medicaid, concerns about that information or use of healthcare services being used against people in immigration determinations. The Biden administration issued new regulations that kind of undid all of that, just recently went into effect. But there is a resolution on the Senate floor now looking to overturn that. So asking some people in some key states to, if you have a couple minutes today, reach out and just encourage your senator to vote no. So I'll put those states in the chat. The Biden administration regulation was important because it made it really clear that DHS would not use of Medicaid or other healthcare or other public programs against people in immigration determination. It was a really hard fought win by immigrants and immigrant justice organizations, and they're encouraging people in these states again, if you have a couple minutes, just call the office, encourage them to vote no. So I'll put those states in the chat. I believe this would be lobbying. So just a flag for people, if you're not allowed to do that, then sit this one out. And if you want any more information about this effort, feel free to reach out. The threat right now is somewhat low. This would have to not only pass the Senate, but also the House and get signed by President Biden, which is obviously unlikely to happen. It's his administration's regulation, but it does represent a resurgence in attacks on immigrants and is sort of part of these broader attacks on Medicaid. So obviously we all know that's deeply connected to oral health in a number of ways. So if you want more information about that, again, you can reach out to me and definitely sign up for the Protecting Immigrant Families campaign alerts if you're not already. Okay, I'm going to step off my soapbox now and want to shift into doing a little bit of a check-in on the public health emergency unwinding. We've left some space over the last couple of months for that, just to check in with people and see if there's anything happening in your state that you want to share or ask questions about. I'm going to do a little bit of a shout out to Gary from Missouri. I think I saw Gary on for getting a local radio spot on this issue, particularly around the number of people who would lose dental coverage. So I will put the link in the chat to that, and not to put you on the spot, Gary, but if there's anything you want to share about that, feel free to jump in.
Well, I've asked around anybody that I know, including coalition members, if anybody heard me live, but apparently not many of the people I know listen to AM talk radio. So I'm thinking I hit a different demographic on that one, but yeah, thanks. That was brought to me. So thanks for doing that. I was glad to do it. As a dyed-in-the-wool introvert, I love being interviewed live on the radio with no idea what they're going to ask me. I'm really into that.
Thank you. And now you got to talk about it again on the spot with no idea I would ask you about that. So a double you're welcome.
Helps.
Thanks, Gary. That's great.
Goals. Thanks.
So big congrats on that. And I'll just leave a couple minutes to see if anybody else has updates or things about the Medicaid unwinding in your state that you want to raise with the group.
Well, again, sticking with my introvert thing, I'll talk. There's a group of advocates in Missouri that have been following, Medicaid enrollment, participant enrollment, for various reasons for quite a while now. And of course, we're watching this very closely. And I would just say, I think in reality, although our Department of Social Services is generally running better than it has in the past with all of those functions, nobody really knows what's going to happen. It's unnerving. We really don't know how many people will be impacted. We don't know how. We think, as I said in the interview, that's probably, at least I think I did, it's kind of going to roll out over time. It won't hit all at once. But it feels like one of those things that we're going to look back on it and go, God, that was messy.
See a lot of nods on that front. Certainly reflects what I've heard from other folks too, that not quite as much transparency as people would be hoping for. Other updates, things people want to share about the public health emergency ending? Well, we're ahead of schedule, which is good because we do have to pause for a birthday celebration. I'm just going to embarrass everybody today is apparently what's going to happen, but happy birthday to Tanya. And thank you, Stacy, for letting us know that it's Tanya's birthday. Also want to call out, Stacy put in the chat an AI DPH opportunity, so take a look at that as well. All right, so we're a little bit ahead of schedule, which is good. And I'm going to move us to some of our state updates. So we have Nicole Payunk from PCOH here in Pennsylvania to give us a little bit of an update from PA. So I'll turn it over to Nicole.
All right. Hello, everybody. As Casey mentioned, I am from Pennsylvania, and I am the Policy and Advocacy Coordinator for the Pennsylvania Coalition for Oral Health. And we, like many of you and many of the states represented here, are still working to get our adult dental benefit across the finish line. So I do have a specific question that I'm going to pose to the group, but I want to lay a little bit of a foundation as far as where Pennsylvania is coming from and kind of where we're hoping to go. So like many states in 2011, during budget cuts, we lost our comprehensive adult dental benefit to save $18.9 million in our budget. To get them put back without the federal contribution, we're looking at about 74 or 75 million, which in our total budget really is a drop in the bucket, but we understand there are a lot of competing priorities. So one thing that happened when those benefits were removed, our state didn't do that in a legislative way. Our DHS issued a Medicaid bulletin and said there's going to be a change to the benefit. And what was put in place is a benefit limit exception. And it was kind of a workaround, in my opinion, to where they could say they were still offering comprehensive services. However, we know that less than 1% of the consumers' benefit limit exceptions are approved. So it's not really a workaround, and it's not functioning for our Medicaid consumers. And it's not even functioning for our MCOs. It's a very comprehensive process, and it's not very accessible either. So that is one of the things that we have been fighting in this, trying to chunk and piece away getting that benefit back. So there has been incremental progress made, I would say, at least since 2017, when PCOH really has taken it on as a priority for the coalition. And that's been trying to make legislative pushes, working directly with our Office of Medical Assistance Programs, trying to collaborate, see what we can do as far as, encouraging the MCOs or, at least getting their perspective for our advocacy efforts. So to fast forward and bring us up to date where we're at, in 2023 in January, we got a whole new administration as far as our governor, DHS secretary. We do also have a new dental officer as well that we are working and building a relationship with, as well as we have a lot of new faces in our legislators. So actually, for the first time in 12 years, the Pennsylvania House is controlled by the Democrats. It's a very slim majority. Luckily, that was reaffirmed yesterday with a special election. We had a few turnover seats, but it is. So they have the absolute minority in what they need to maintain the majority. So what we're trying to do is use the momentum that we have, because we have verbal support as far as like, oh yes, the governor says, he recognizes the importance of oral health. He did include an 8% fee for service increase in the budget. Hasn't been approved yet, so we're still keeping our fingers crossed for that. We have verbal support from, DHS recognizing, the importance between oral health and total overall health. But what we really want is we want some action. So we were able to connect with a previous legislative champion, and she has sent out a memo with 2 other sponsors. One is actually a Republican, which is really great. So we can start, with a step in the right direction for that bipartisan support. And again, it's just a memo. It hasn't been introduced to committee. But one of the questions that was posed to our group that we need to consider in how we're going to promote and advocate for this is, what incentives are there for providers to sign on and be a Medicaid provider if we restore the benefit? Well, to me, in my head, I'm like, oh my gosh, that's a part of the implementation part. That's after we get this figured out. We say, let's get the providers on. So I will say right now, it was kind of a field of dreams mentality. If we build it, they will come. I didn't like the movie, and I'm not really a fan of kind of moving forward with that. So what I'm asking or hoping to get from the group would be, what are some maybe preemptive strategies to garner support while we're looking to get this passed, through the legislator. So if that makes any sense, it was quick, but tried to be succinct.
Thanks, Nicole. Any insights from folks around incentivizing providers to enroll in Medicaid?
So we have a whole project where we're trying to get dental providers to enroll in Medicaid. Thank goodness for grant funding, or we wouldn't be able to do it. But we're doing a media campaign to try to get the word out. We have a staff member who's dedicated to supporting providers in all aspects of becoming a Medicaid provider. We find we're kind of having to cut through old mythology on the private practice side among providers that haven't done Medicaid, which is the majority of them. So it's an uphill battle. We're doing a lot of educational things too with this, a lot of webinars, some of which is more akin to marketing educational things, but you get the idea. So it is a challenge. We're very aware that just because we have great Medicaid dental rates now doesn't mean we're going to get people to sign up. So I think what we're doing is a big experiment, and I hope to be greatly successful with it, but we'll, check back with me later.
Gary, can I ask, with that funding or that staff position, what is the time frame of this project that you have for right now?
Well, I wish it was 5 years, to be honest with you. I think, the way I frame this is traditionally it's a bifurcated system with one set of providers for kind of public benefit and low income, and another set of providers for middle class and above. And we're trying to cross that chasm and get these private practice providers to think of this now as a good business proposition. And I think it's a long-term thing. We have actually 2 grants to support this, one of which is a 2-year grant, and provided enough funding that we could do a pretty sophisticated and expensive media campaign, which is really just now getting to go. And then the other grant is smaller in 1 year. I'm already trying to figure out a way to keep it going past that, because I just think I do think it makes a difference, at least psychologically, for private practices, especially for the practice managers, to know that they have someone besides the state of Missouri to call. The state of Missouri tends to answer, we've got a manual out there, go read the manual for any question. And for a practice that's never done Medicaid before, that's like a deal breaker. That response right there just kind of ends it. So we're trying to get in there, in between there, and let them know they've got someone to hold their hand at least, and try to assist and try to troubleshoot. It has kind of flushed out sort of other problems with our Medicaid system besides the rates, which I think have policy implications, but we're just, I mean, some of that stuff, I won't get into that, but some of that stuff we were aware of, but it's a little more pointed now. So we're just now starting to talk about that, what can be done about that. Some of it's things actually we have pushed on before and haven't gotten anywhere, but now it looks more relevant.
Great, thank you. And I do like the idea of having a support person for the providers. I think sometimes with that public health mindset, we can maybe get a little too tunnel visioned in on the consumer and recognize that the providers are going to experience a change, hopefully with this as well, or something that they're new to. Because right now, I hope my data is correct off the top of my head, but we have about only 23% of our providers accept Medicaid right now. So we definitely want to see that number improve. And reaching out to our PDA chapter, our Pennsylvania Dental Association, seeing if they would be, supportive in helping us, because we know that they can have a very active arm in policy. So that is definitely on our agenda as well.
Yeah, I mean, we have a very good relationship with the Missouri Dental Association and this project, and they're doing a lot of things for not just their members, but for any dentists that reach out to them with this too. So they have stepped up. But I think through this project, one of the things that has been of benefit already is we have a very close working relationship with them around getting providers to come to Medicaid, and a very close working relationship with two of the state components that deal with providers. So we actually have a little team that meets every couple of weeks, and we try to stay in touch with each other and kind of lined up. And I think that's been very beneficial all the way around. As an advocate, it also makes me think twice about how we advocate for things that involve the state Medicaid agency, because we don't want to blow that relationship out of the water. It is of benefit. So yeah, that's an important piece. That is absolutely an important piece.
I think this is another one of those evergreen questions. I'm sure we'll come back to it. A couple other things in the chat around workforce and some information from Minnesota about safety net practices too. So thanks, Nicole, and thanks everyone. I'm going to turn it over now to Belkis Garcia from New York to talk about, I think, a pretty exciting update on Medicaid adult dental benefits there.
Yeah, hi everybody. Can you hear me okay? Yeah, okay. So I'm Belkis Garcia. I'm a staff attorney at the Legal Aid Society in New York City, and I was invited to talk to you all about a lawsuit that we recently settled. So I'm going to start by giving you just like a little bit of history and background of New York, so there's like some context. So New York has had, we enacted Medicaid in 1966, and we already had a long-running large public health program with federal funding at the time. And so we have covered optional services from the beginning, including dental. And our first dental manual was about like incorporating that program into the new Medicaid program. The problem is that the clinical standards were not really updated since 1966. And those all exist in, it sounds like this crowd is going to be familiar with a lot of these things that I'm going to be talking about in our dental manual, right? So our framework is we've got our state law, we've got regulations, and then we have this New York State Department of Health manual where all of the like nuts and bolts, nitty gritty coverage rules are. And we hear a lot from the New York Department of Health, but also from like national oral health advocates about how New York has like one of the most generous dental programs, and we provide root canals and crowns and dentures. But I think that those assessments, they kind of ignore what the actual coverage rules are in the manual, and like how that actually impacts people who are trying to access the care. Just because there's like a code doesn't mean that people actually get the coverage. And so that's why we brought the case, and we wanted to, we felt that we needed to really get at the manual, because that is the thing that was functioning as the barrier for people. It's super duper common, as I'm guessing you all know, for people to be contacting us and saying like, I have a denial of some kind of, have a Medicaid denial of some dental service, right? And for many, many years, we just didn't really have great legal remedies, individual legal remedies for people. People would do administrative hearings and they would lose because the coverage rules were so narrow. So we filed our case in August of 2018. At the time that we filed, the case only addresses 4 services. It's dental implants, replacement dentures, root canals, and crowns. When we filed in August of 2018, it was just about implants dental implants and replacement dentures because those were the services that our particular clients at the time were not able to access. And the rule at that time for dental implants is just that it was not a covered benefit at all. And replacement dentures, the rule was that you could get them after 8 years. You can get your dentures replaced after 8 years. There were some exceptions to that. The exception being if they become unserviceable through disease or trauma or extensive physiological change. If your dentures were lost, stolen, or broken, you had to demonstrate that you were seriously ill in order to get them replaced within the 8 years. After we filed our case, the Department of Health pretty much immediately changed the rules. And they said, okay, for implants, we will cover them in some circumstances, those circumstances being that you have to get 2 letters, a letter from a physician explaining how dental implants are going to alleviate a separate medical condition that you are seriously ill with, and a letter from a dentist explaining why you can't wear dentures, basically, or other covered prosthetic services. And then on replacement dentures, if I give them the benefit of the doubt, I think they thought they were expanding the rule, but it functionally restricted it. They basically did the same thing for replacement dentures. They said, okay, you can get them in 8 years if you're seriously ill and you have these 2 letters, and it's going to alleviate, replacement dentures is going to alleviate some other condition. I won't go over all the procedural history of the case, but I'll just say that we amended our complaint to address those old rules, these new rules, these amended or updated replacement denture and implant rules, and then to add root canals and crowns. So this is where I think that, people think that we have root canal coverage in New York. We largely do not. For anyone over 21, the rule for molar root canal, for molar root canals is they're not covered if you're over 21 unless it's medically contraindicated or you need it for your denture. There is a threshold rule that impacts these services, but really a bunch of other services. We have an 8 points of contact rule. If you have the 4 teeth in the back of your mouth that touch, or 4 pairs, that's all you need. So that means that in New York, they just pull your teeth. Until if you need a root canal or crown, if you have those 8 teeth, you're not getting that covered. Your teeth will just be extracted until you've lost 8 points of contact or half or more than half of your teeth. And then they're going to cover dentures. And then they're not going to replace your dentures for another 8 years. And then if you can't wear those dentures because of bone erosion and you need implants, they're not going to cover it until you get super sick, right? So we have been litigating this case since 2018. We have been in settlement talks for a long time, and we did just settle the case. We filed this month. What we filed is a motion for preliminary approval. So that meant that we were allowed to announce it. I think that in order for this settlement to really work, people need to be requesting these services. Dentists need to be putting in the request for prior authorization. We fully expect that managed care plans are going to deny it because that's what they do. And we are going to have to be doing appeals, right? But that hasn't started yet. We are waiting for court approval. So I don't actually know when the new rules are going to go into effect, but the new rules, it's kind of detailed, but it's not as elegant as I would like, but that's negotiation, right? That's a settlement. Everybody's a little unhappy. But it does remove the 8 points of contact rule for root canals and crowns. It means that people are not going to be denied because they have too many teeth. And in fact, it inverts the rule. It's trying to save natural teeth where they can be saved. And one of the factors that needs to be looked at is that if you have 8 points of contact, that is in fact a reason to save teeth, because it will prevent the kind of cascading problems people have once they start losing more and more teeth, right? There are a number of other factors that they can look at for coverage. I think one that is important is that if the tooth is needed for balance and function, if it's a back tooth, that's a reason to provide coverage. Yeah, so it's going to, we hope, really drastically expand coverage for these services in New York. For implants and replacement dentures, it removes the you have to get sick with something requirement, and it removes the physician letter. And there's a prior authorization form that the dentist has to fill out that includes, medical information, because the Department of Health wanted to make sure that people were being screened, that they were medically appropriate for this procedure, but our state allows dentists to do that. Their license allows them to determine when somebody is appropriate for this surgery or this service, and to reach out to a physician when that's needed. So the prior authorization form, which is also a thing we negotiated, will, allow the dentist to, or requires the dentist to fill out this form with certain information. So it gets rid of that letter requirement, and they don't have to show that they're already very sick. I have all these notes here about like legal stuff, which I feel like maybe we shouldn't go over. So anyway, that's the announcement. I wish I could say when the rules are going to be in effect. I think at best they could be in effect in the fall, but again, it really kind of depends on when the judge approves it, and that whole process. The way that the settlement is structured is that even that after the effective date, the new rules won't go into effect for 3 months. And in those 3 months, the Department of Health has to do some education. They have to provide training. They have to send out enrollee letters. There's like a bunch of things that need to happen. And the reason for that is we hoped that by the time people show up at their dentist's office, the dentist will know, plans will know, and hopefully it'll cut down on the amount of denials that people will receive. Yeah, so I guess maybe stay tuned for actual effective dates, but that's kind of the top line headlines of that.
Thank you so much, Belkis. Questions that folks have? Sort of an innovative class action lawsuit, sort of an innovative strategy we don't talk that much about. So it was great to hear a little bit about that. Obviously, very long-term strategy, but all right. If questions come up, feel free to put them in the chat, but I'm going to keep moving us along and hand it over to Alicia Watley from Kentucky Youth Advocates to give a Kentucky update.
Awesome. Thanks, Casey. And I apologize for not being on camera. I'm in transit today, but I'm Alicia Watley from Kentucky and with the Kentucky Oral Health Coalition. So many of you are aware that Kentucky has had a lot of movement around our adult Medicaid dental benefit this year. So prior to the beginning of this year, we had a limited adult benefit that pretty much just covered one cleaning and extractions for most of our adult Medicaid population. And it went into effect via an executive order from our governor on January 1st that the adult population would get an expansion of those benefits to have comprehensive dental coverage. And that started January 1. Our legislature was not happy about the decision from our governor to kind of make that without their consent and allocating money in their view towards that expansion. So during our legislative session this year, they moved legislation that passed to rescind the expansion. So at the end of March, when our legislative session wrapped up, we saw the benefits were rescinded for our adult population. So they had them for about 3 months. We had thousands and thousands of folks accessing those benefits during that short period of time. So we know that many folks were in need, but unfortunately that was taken away. After the legislative session ended, we saw the administration refiled new regulations that looked very similar to the previous ones to once again expand the benefits. And our legislature once again very quickly convened a committee about, I think it was last week, and found the regulations to once again be deficient. So at this time, the benefits continue to be up in the air. the way that the process works in our state, there are still a couple of paths forward that we see as an opportunity to work through this disagreement between our executive and legislative branches. But I think that there's quite a bit of work on the part of hopefully the coalition, but also just advocates and the providers in the state that are in support of the expansion to kind of sway some of our, especially legislative members that are not on board with this. And so we have several important things coming up over the next 2 months in terms of more hearings, bringing testimony, and getting folks kind of advocating around this issue. So for the immediate time being, we have an expansion in place. The regulations are in place because they were filed as an emergency. So the deficiency finding does not take that away, but there are still a lot of opportunities for them to either be solidified or rescinded once again. So unfortunately, don't have a lot of solid answers on what's going to happen, but definitely some opportunities for us to do some advocacy there. And the other piece of that has been really important to our providers and to our state legislature in terms of spending is that there is an increase in fee in reimbursement rates for our providers attached to this, which is very much needed across the state. So we're hoping that that piece can stick as well, because a lot of our providers have been sort of one foot out the door of the Medicaid program to begin with. So if they do not see the rate increase stick around, they might be likely to leave the program as well. So that's kind of where we're at in Kentucky. It's a roller coaster for the whole year on what's going on and where we're going to end up, but happy to answer questions or if folks have been following along.
Hey, Alicia, this is Parrish with Community Catalyst. Just a quick question. We recently touched base with an organization, Kentucky Voices for Health, and it's a new group to us, and so I was just curious if they are somebody that you connect with in the state.
Yeah, that's one of our, I wouldn't say we partner with them a whole lot. It kind of depends on what the coalition's focus is at the time. They are a group that works mostly on safety net supports and different, social service programs and those kind of things. So of course, when Medicaid is kind of brought into the conversation, they are engaged. But yes, I am working closely with some of their contacts on this issue in particular, because I know that they're interested in providing testimony as well.
Cool, thank you.
Other questions for Alicia? Okay. Well, thanks, Alicia. And thanks again to Nicole and Belkis for those updates. We do have a couple of extra minutes, so I just want to open up the floor and see if folks from other states have updates or discussion items or questions you want to share.
Hey, it's Jen from Arizona. I don't see Brianna on, but I know she was on last month, and we were so excited because this was going to be the year. It ain't going to be the year, apparently. We passed every committee, every hearing. We had resounding support. Got budget bills started dropping last week, and no preventative dental was added. There's all kinds of speculation, but generally it appears that anything that was an ongoing expenditure was not included, which isn't completely correct because they did do some ongoing expenditures. So at the moment we're sunk, but they passed all the budget bills and did a bunch of work on Monday, and then they recessed again till June. And we're through Children's Action Alliance and our supportive members of the legislature. We're trying some last ditch things, maybe a pilot, maybe a limited benefit, maybe just give us 3 years, just cap the number of folks. Like, we're trying to put some things through, but So far, it's not going to be, it may not be our year, but we're so organized for next year. And on the upside, dental therapy finally made it through Bodex, and we are at GRIC, the Governor's Regulatory Review Council. It went through the first 2 hearings, if they call them hearings, no questions. So we're in a waiting game on that. So after 5 years, maybe we'll be good to go to start hiring.
Excellent. Thanks, Jen. I'm sorry to hear that about the adult dental bill, but thanks for the update. Other updates from folks? All right. Well, I know that we have a couple of open updates, so I'll turn it back over to Bianca.
Thanks, Casey, and thanks everyone for joining us today. Just 2 quick updates, and I'll put them in the chat here. As you know, Open Hill Day is this year on September 12th and 13th. And registration for that will be coming out in early June. So keep an eye out for that. Of course, we'll continue to update you in this meeting, when any new things are, when any decisions are made. We also wanted to alert you to the next learning community that's going to be focused on diversity, equity, and inclusion on June 28th at 3 p.m. This is a meeting between CareQuest grantees, and any open members are welcome to join as well. And mostly focused on workshops, peer learning, on specific topic areas. So the registration link I've added to the chat there. And with that, we hope to see you at the next Learning Collaborative meeting of this group on June 21st at 2 p.m. So thanks so much for joining us, and we'll see you next time.
Thanks,
Bye, everyone.
everyone.
Bye-bye.